at FEMA-news-desk at fema.dhs.gov. And with that, we'll begin with EPA Region 5 Administrator Deborah Shore.
Thank you, and good afternoon, everyone. I'm Deborah Shore. I'm the Regional Administrator for EPA Region 5. Thanks for joining us today. I'd like to start off with a few operational updates that demonstrate the progress that's being made to support the community in East Palestine. EPA has conducted 574 home re-entry screenings to date and continues air monitoring at 15 stations within the community. I'm pleased that there have been no exceedances for residential air quality standards, and outdoor air quality remains normal. We will continue to offer the air screening to any resident within the evacuation zone who wants a screening. Yesterday, we set up a new information hotline. It's posted on EPA's website, and the number is 866-361-0526. FEMA, which has broad and deep experience running call centers, will staff this call center. And those answering the phones will have information to share with callers, and when they don't have answers, they'll provide contact information so EPA can follow up. I'm excited to share that residents and business owners will be able to begin the intake process for scheduling cleaning services. Finally, EPA and other responding agencies will participate in a public meeting and open house on Thursday, March 2nd at 6 p.m. at the high school. I also want to address some of the reports you may have been seeing regarding disposal of contaminated waste. Yesterday, we instructed Norfolk Southern to pause shipping waste off-site. Until February 24th, until yesterday, Norfolk Southern had been solely responsible for the disposal of waste generated by the East Palestine train derailment. The company supplied Ohio EPA with their list of selected and utilized disposal facilities on February 23rd. Moving forward, waste disposal plans, including disposal location and transportation routes for contaminated waste, will be subject to federal EPA review and approval. EPA will ensure that all waste is disposed of in a safe and lawful manner at EPA certified facilities to prevent further release of hazardous substances and impacts to communities. I've been able to visit East Palestine multiple times since the derailment. I've had a chance to meet with Mayor Conaway and to talk to other residents. And one thing that's been made clear to me is that everyone wants this contamination gone from the community. They don't want the worry and they don't want the smell. And we owe it to the people of East Palestine to move it out of the community as quickly as possible. At EPA, we have decades of experience dealing with hazardous waste, both from cleaning up contaminated sites to regulating the landfills where it's disposed of. And we know it's far better to have it safely stored in a properly constructed and monitored disposal facility than to have it remain here any longer than necessary when there are licensed, regulated disposal facilities available that routinely dispose of similar wastes. At the same time, I know there are folks in other states with concerns, legitimate concerns, about how this waste is being transported and how it will be disposed of. EPA will continue to work with our local, state, and federal partners to use our long-standing experience and expertise in these matters to ensure the health and safety and support the East Palestine community and to hold Norfolk Southern accountable. Thank you. And now over to Ann Vogel of Ohio EPA.
Good afternoon. I am Ann Vogel, Director of the Ohio EPA. And I just want to say once again, thank you to the residents of East Palestine. Thank you for continuing to share your concerns with us and ask good questions, to educate yourself on the science. I've had really good conversations. I want to thank the mayor and the chief, who have been just as solid as it comes in terms of representing their town, looking out for the residents here, and they've been a pleasure to work with, and really digging in on the cleanup and what it's going to take, right, to make East Palestine a great comeback, as the sign out front says. I love that. So, a couple quick updates on the cleanup front. If you have been anywhere near the derailment site in a while, it's definitely looking better. You can see dirt being hauled, liquids being stored, hauled off and stored. You can see the scrap being removed. That's all, again, part of that initial phase of emergency response. So we're moving into the remediation phase. We're cleaning up sulfur. We're cleaning up Leslie Run. You can see that work underway with the aeration, with the pumps. You can see the new Sentinel wells that were drilled near the municipal well field. Those are monitoring wells. We will be able, for years to come, to know if there are any contaminants approaching the municipal well field. So that's part of that long-term, that early detection system that's going to protect this community for years to come. So I appreciate this opportunity. On behalf of the governor, I want to say stay strong, listen to the science. There's a lot of good information out there on the website. The governor's commitment to you, the people of East Palestine, has been, we will be transparent, we will stay here, we will be here as long as it takes to clean it up. Thank you very much. And I'm going to turn it over to my friend Lydia Mahalik.
Nice job, Director Vogel. Well, good afternoon. My name's Lydia Mahalik. I'm Director of the Ohio Department of Development. Over the last day or so, I have had the pleasure and opportunity to meet with many of East Palestine's local officials, business owners, as well as residents. And I got to tell you that despite the horrible situation that this community has had to deal with, I've been so impressed by the resolve of each person that I have encountered to see their community through this absolute ordeal. Mayor Conaway and Chief Drabick, each of you are doing a tremendous job representing your community and advocating for East Palestine. I also want to say thank you and commend the workers who have been on site, as well as our first responders who have been working tirelessly on this cleanup and the efforts that are being undertaken to restore East Palestine. And while certainly there is a lot of work left to do here, I can tell you that based on what I have seen, a lot of progress has been made, and the recovery of this very vibrant community is underway. To that end, Governor DeWine, Lieutenant Governor Husted, and our team at the Department of Development are here for the long run. And we're going to do all that is necessary to help the people and the businesses in this community to get back to life as they knew it before this accident. A lot of information has been disseminated over the last several weeks for residents that need assistance, but we also want to make sure that our businesses are getting the help that they need. So for any business owners who have questions or need help, please contact our team at businesshelp@development.ohio.gov. Again, that's businesshelp@development.ohio.gov. We're here to help. So at this point, I'm going to turn it over to Regional Administrator Thomas Seebeck. Thank you very much.
Thank you, Director Mahalik. I want to take a moment to echo the sentiments and recognize this is an incredibly difficult time for this community. But the group behind us and the group behind me are standing here today to represent a united front and coordinated federal response that is here to do everything we can to ensure Ohio has the tools and structure it needs to help East Palestine recover. We see you, we hear you, and we are here to help. Yesterday, the Biden-Harris administration announced that the federal interagency teams from FEMA, HHS, EPA, and the CDC will conduct outreach to help provide support for residents of East Palestine. Today, our teams went to 4 fixed locations staged throughout the community and engaged with the community emergency response team who were out there, who come directly from the community to those that were impacted by this disaster and engaged across the area, the community emergency response teams. Over the coming days, we will continue to ramp up our outreach across the affected communities to ensure we are meeting people where they are and connecting them to the critical federal, state, and local resources. Additionally, we continue to provide technical assistance to our partners at the EPA for a call center assisting East Palestine residents and businesses. As a reminder, that number is 866-361-0526, and you can call anytime from 8 a.m. to 8 p.m. Eastern Standard Time. As we help our interagency partners with this outreach, FEMA will continue to support operational coordination, logistical planning, and unity of effort. FEMA will continue to do everything we can within our scope and authorities to assist this multi-agency effort and remain closely coordinated with our partners at every level of government. We continue to support the community and community's emergency response teams to meet people where they are overall. And with that, I'm going to turn it over to Captain Seeger from the CDC.
Thank you very much. Good afternoon, everybody. My name is Captain Jill Sugart, and it is an honor to be here serving as the CDC ATSDR East Palestine team. Thank you very much for the Ohio Department of Health and the Pennsylvania Department of Health as well for their invitation to try to help out on this very important mission. And it's also an honor to join our colleagues at EPA and FEMA as unified command for this mission. We're here, we have a 19-person multidisciplinary scientific team. We really are focusing on our assessment of chemical exposure survey. We are planning to do some surveys in coordination with our local, state, and federal partners both to get some more information from residents, businesses, and also potentially impacted first responders. Today, we were able to join the on-the-ground teams and really got a very warm reception from the community. Again, we're happy to be here to try to learn a little bit more information about any potential health effects that may have occurred to individuals as a result of this incident. Tomorrow, we will also be working closely with the Pennsylvania Department of Health to conduct another ACE survey to get additional information. We also are looking forward to being present on Monday at the EPA Welcome Center, where we'll have additional health education materials, and we'll also be staffing that with some of our scientists to help answer any questions. So with that, again, it's really an honor to be here, and I will turn it over to Deborah Moore with CERT.
Good afternoon. My name's Deborah Moore with the Columbiana County Community Emergency Response Team, that's CERT. Initially, we were deployed to help set up the emergency shelters at the initial derailment. Since then, we've put in hundreds of man-hours. Most recently this week, we've been tasked with reaching out to individual households with informational sheets that provide all of the phone number contact lists that they may need to access the resources. It shows them on the sheets how to make an appointment at the clinic, how to reach out if you want your well tested. A lot of questions people have had. You know, they're trying to get their lives back together. They're very busy. They don't know where to call. They have trouble. So these informational sheets have been hand delivered to them personally this week by the team. We're between 300 and 400 households right now. I don't have today's count, but it's an ongoing process to provide the resources for the households. Thank you. I think the mayor.
Thank you. And with that, we'll take questions. Sir. Yes.
NBC News. I am federal EPA and then one for the state EPA, but for federal EPA, you said that Norfolk Southern was told it needed to stop temporarily removal of waste. One, has that resumed, and two, does that mean they were doing something wrong?
Did you all hear the question? It has to do with the removal of contaminated waste off the derailment site. We have instructed Norfolk Southern to pause, but only temporarily. We've been working throughout the day to identify sites that are CERCLA approved and can accept that waste, and very soon they'll be moving again to those sites.
Why didn't that happen before they even started removing waste?
Well, as I said earlier, federal EPA did not assume command of the entire program until the 24th, due to the unilateral administrative order that our agency issued on Tuesday of this week.
So, but does that mean they were not working with contractors they should have? Like, why did they need to stop? Clearly, they weren't up to your standards, it sounds like.
No, I believe that all the facilities were up to the standards that were in place prior to the unilateral order, but we did hear from residents who were concerned and others in a number of states, and we're reviewing the transport of some of this waste over long distances and finding the appropriate permitted and certified sites to take the waste, as we do with other contaminated sites all the time around the country.
So it's just your team doing a check now that you've taken control? Is that a fair way to characterize it? It's your team. Now that your team is in control, you're checking, you're doing your own due diligence.
That's right, and we're working hand in hand with Ohio EPA on this, and it's following under the unified command that was established by that unilateral order.
Okay. Next question.
What is the regional EPA's position on that control burn? I mean, did it add risk, to the people, for the people and what they were exposed to? I mean, does anyone here plan to examine that decision-making process?
That decision was made by the local officials and a variety of state officials. It wasn't made by EPA, but certainly it was a well-founded decision based on the information they had available at the time to deal with a highly explosive toxic chemical.
And what's your position on it, being that, seeing that these, talking about the short-term and long-term effects here?
We haven't seen any short-term effects, and we're continuing to monitor for sure, and we will be here until the residents of the larger community of East Palestine say that they're ready to see us go.
Researchers at Texas A&M took the EPA's own data and determined there are indeed elevated levels of toxins that could cause damage over the long term. Is that in contrast to what we've heard to this point, and what's your response to that?
I'm not familiar with the analysis of that data. I'm happy to have a look at it and give you a response.
Question for state EPA. Huffington Post is reporting that your department and the governor's office deemed the drinking water in this community to be safe, only relying on data provided by a testing company that was contracted by Norfolk Southern. I wondered if you could comment on that, if that is in fact the case.
Happy to. Thanks for the question. The governor's statement that the municipal water was safe, which is what the mayor was also saying the whole time, it was backed up by lots of data. There was the Norfolk Southern had a contractor that did testing. That test was split sampled. A sample was also taken by the county. Those county results are final. They are posted on the county's website. Ohio EPA took tests starting this week. We will test weekly the municipal water. Those tests are also posted on our website. Those results, I'm sorry. In addition, though, I want to be clear that there was a weight of evidence that the municipal water was safe. It is not in the path of the contamination from the derailment. So there was a lot of science, and so No, I don't agree.
Well, when the determination was made, when the governor publicly said the municipal drinking water is safe, at that point, did your department have anything back other than the Norfolk Southern funded data?
I apologize, I don't know the exact timeline of when we got the county's preliminary data as well, but we also knew, based on where the well field is and how the groundwater flows, that the well would not have been in the path of contamination.
I understand the path issue, but if you can't answer that definitively, doesn't that mean you don't know that to be the case?
Yeah, question for the CDC. We're hearing about reports of, I believe, chemical laryngitis. I'm just curious if you have any updates on that and what the symptoms are, what people might be experiencing that you've seen so far.
Sure. So I cannot confirm any of those reports, but I think that's why it's so important that we're trying to get our ACE survey out. This is a survey that will allow us to collect information from residents about some of the symptoms that they are experiencing, along with some demographic information and whether they were in the area during the incident, whether they evacuated. And what we can do is take a look at all of that information and analyze it to see if there's any health concerns.
Lauren Ledger from KDKA and CBS Pittsburgh. Can you try to explain, obviously, we're hearing the air quality is safe, we're hearing the water quality is safe, but people are still getting sick. Obviously, there's some people who are having this chemical bronchitis. There's animals who are getting sick. Can you explain why people may be getting sick, but these quality and readings are showing safe levels?
So we do understand that there were a lot of hazardous materials that were spilled at the incident. However, we really need to look a little bit more at the data. We're working very closely with our federal partners at EPA as they are leading those efforts on the air, the water, and the soil, and we're taking a look at that from a health perspective. Just today we were out giving information to the community on if they did have any symptoms that they were concerned about, what they could do. They could call their doctor, they could make an appointment at the health assessment clinic and also fill out the survey.
But how is all that declared safe if people are getting sick?
So again, we are continuing to monitor the situation and can provide public health recommendations as needed depending on those results.
Yes, ma'am.
I'm a reporter with KBN in Youngstown. I know a lot of people in Pennsylvania and also in Ohio, Jared Brown, have expressed concerns about dioxins. Are we doing anything long term to look at the possibility of those and if so, potentially mitigate that?
Administrator Schwartz.
We did receive a letter from Senator Brown and Senator Vance. Our toxicologists are taking a look. Unfortunately, we don't have any baseline information about the levels of dioxins, which are produced also by wildfires, by backyard grilling, by a host of other things. We have been looking at a series of tests, but at the moment we're not testing precisely for dioxins, but we may in the future.
Okay, two more. Yes, sir.
This question is for anyone who has spoken with local residents in the past few days. We've had a lot of high-ranking governmental officials over the past few days, Trump, Vance, etc. Do the residents around here feel like their presence made a positive impact, or do they feel better about the situation here with those who are aligned?
Good afternoon. Yes, from what I'm understanding, the residents feel that there was a positive impact. I think the residents have a concern that this is a political chess game, as I've mentioned multiple times. But I think they want to be noticed, and with the public officials coming in, I think we are being noticed. So yes.
Especially for the Federal Railroad Administrator who talked prior, I think that we probably all want to hear from you. Can you explain when the last track maintenance was on this railroad, and as well as why was Norfolk Southern about to replace the tracks without removing the soil?
Can you repeat that again?
When was the last maintenance for these tracks before the derailment, and also why was Norfolk Southern able to remove and replace the tracks and start going before removing the soil?
Well, I'd have to look
at their records, to find out when they did the last capital program on here, where they come through and do track maintenance, and make sure everything's within compliance of the federal railroad regulations. But when a derailment happens, they come in and they do a massive cleanup, and they put panels in there to get the tracks back into service so they can start running trains again.
But why wasn't the soil removed first and dealt with before getting these tracks back up and running?
Because it's. I don't know. I mean, it's not part of the plan on remediating the derailment and all stuff. So now, they did all that remediation. Now they're going to come back in and probably do a full-fledged capital program through it to redo everything.
Who is responsible for putting those tracks back in place?
Norfolk Southern.
Okay, so they put it back in place with your permission?
No, the Federal Railroad Administration is just safety. We come out and monitor the railroads all across the country, for safe operation, and they're in compliance with all the federal regulations that they follow.
Mayor, what kind of testing data was shared with you prior to the governor announcing that the municipal water in the community was safe? Because just again, going back to what I was asking the state EPA, it sounds like it wouldn't be an automatic need to have non-railroad data before making that determination.
The data that was shared with me was all tests performed by CTEC, and there was data shared through our county health department. They all worked together before that was deemed safe. So the Ohio Department of Health was in that decision too. It wasn't just the governor's office. So everybody, Dr. Vander Hoff, he was part of that decision making too. It was made as a team, and then it was put out.
So you saw government data independent from the railroad's data on the drinking water.
Absolutely, it was a split sample. So, and we have our own in-house samples too. So we had those prior to that too. So, all right, I think we're done. Thank you.
Thank you, everybody. If you have any follow-up questions, again, the FEMA news desk, FEMA-news-desk at FEMA.dhs.gov. Thank you.